Hello, I am Dr. Mirela Cernăianu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and thank you again for joining me on another episode of the Wellness Optimizing Warrior MD, specifically targeting strategies for preventing uterine cancer. Now, a lot of the strategies and things I'm going to talk about in this episode are really very broad in the sense that they will not necessarily target uterine cancer, but they will target any cancer. So I will talk a little bit about what we can do to prevent cancer in general, but specifically as well uterine cancer. In the last episode, I talked about warning signs and symptoms. So today I want to talk prevention. And let me start by talking about the fact that we can take actions as women very early on in life to prevent uterine cancer later in our life. In one of the recent past episodes, I talked about endometrial hyperplasia, where I started talking about uterine pathology, and I explained how endometrial hyperplasia, it could be a cancer precursor if you develop atypical cells in this hyperplasia development. And as a reminder, hyperplasia means excessive growth of the uterine lining, which stands for hyper or extra growth, and plasia for growth. So excessive, uncontrolled, and unbalanced growth of the uterine lining signifies this danger of developing hyperplasia, and the presence of atypia, which is abnormal atypical cells within this hyperplastic development, is what actually drives the increased risk of uterine cancer. So what is the lifetime risk for uterine cancer? Well, the American Cancer Society estimates that about 1 in every 37 women in the United States will develop uterine cancer during their lifetime. And this is the average risk for women in the general population. And the risk of developing uterine cancer, also known as endometrial cancer, varies among women based on several factors. So let's talk about what these factors are. They are age, hormonal factors, obesity, genetics, lifestyle choices, and last but not least, medical history. So here are some of the key points to consider regarding your possible risk of uterine cancer and whether or not these factors might apply to you. Number one is age. Uterine cancer is more common in women who are postmenopausal. It's extremely rare in young women. The majority of cases diagnosed in women are over the age of 50. The risk of uterine cancer increases with age, specifically and particularly after menopause. Now, this is a very, very interesting fact, as the majority of women after 50 no longer have estrogen because they are either perimenopausal with lower estrogen, or they have actually entered menopause with zero estrogen. So estrogen in older women is significantly lower. However, perimenopausal women can have surges of estrogen. They can have ups and downs of estrogen. And these are not really balanced by the much needed and absolutely necessary progesterone. So age is important, but remember, whatever is causing uterine cancer is happening before menopause. And we'll talk about that in more detail. So stay tuned in this episode. Number two, after age, is hormonal factors. Hormonal imbalances, such as estrogen dominance or prolonged exposure to estrogen without progesterone, can and will increase the risk of developing uterine cancer. Conditions like obesity, PCOS, estrogen therapy without progesterone may contribute to hormonal imbalances that ultimately affect our uterus. Now, this is a very interesting thing. medicine or all medical sciences blame estrogen for the majority of pelvic organ pathology. However, think about this for a second. Estrogen is a key player hormone in women's health, and without it, many things deteriorate in the female body, which happens at menopause. It is unlikely that estrogen is to blame. However, estrogen alone, always estrogen alone, or estrogen imbalanced without being correctly balanced in its effect, is actually the culprit. I have talked for many hours in previous podcast episodes about how important sex hormone balance is to prevent disease, including cancer. So the key issue for you to remember is that estrogen that is not being balanced by progesterone, or an estrogen and testosterone imbalance, and ultimately a loss of harmony between all these three hormones, the sex hormone trio, estrogen, progesterone, testosterone, is the actual factor that leads to many medical problems, disease, and possible cancer that affects female pelvic organ pathology. Another key issue to remember is that testosterone could be a protective hormone. It does have anti-estrogenic effects on the uterus and the breast, as well as preventing and antagonizing the proliferative effects of estrogen on endometriosis. Now, I'm going to ask you a question here that I'd like to provoke some thoughts on your side. And this is a thought-provoking question or problem. Instead of focusing research on anti-estrogen drugs, which we all know are very harmful, in some cases causing serious side effects, and these drugs are getting a worse and worse reputation with each decade that passes, the more they are being used, why not focus some research on how testosterone therapy can possibly improve quality of life and decrease risk of cancer recurrence in cancer survivors diagnosed with uterine cancer or breast cancer? Now, personally, I'm not in charge of any research, and I do not do research. It seems interesting how this basic information is out there, has been out there for decades, has been out there since the beginning of medical science. We know estrogen and testosterone are opposing hormones. Testosterone is also an awesome hormone for your body as a woman, but no one is grabbing this information. No one is focusing on it. Maybe because it's a more holistic wellness optimizing approach, and researchers are instead being driven by big pharma to spending lots of time and money on the next miracle anti-estrogen drug. Remember this, women diagnosed with cancer at menopause do not have high estrogen. Most of them have no estrogen. So why expose them to the risks of these major anti-estrogen drugs when there is no estrogen? Now, if the woman and the oncologist decide that continuing hormone replacement therapy with estrogen is beneficial and acceptable, then maybe using an estrogen blocker like an aromatase inhibitor that blocks estrogen production and starves the cancer cells that have estrogen receptors of estrogen might make sense. But again, what is the point if our estrogen is already very, very low, like under 30? Now, when estrogen used to be 200, 300, when that woman that now has cancer with an estrogen of 30, that estrogen was that high when the woman was much younger. So driving estrogen to zero is the goal of these drugs, but what is the actual benefit when our estrogen is already super low at menopause? Why not use a natural bioidentical hormone, progesterone, testosterone, maybe both, because they both have a stabilizing anti-estrogen-driven growth inhibiting effects in the cells. Again, this is food for thought that I took a little detour, but let me get back to risk factors for uterine cancer. So number 1 was age, older women. Number 2 was hormone imbalances, estrogen by itself, estrogen alone, estrogen unbalanced. So let's move on to number 3. This is a very big factor that's involved in uterine cancer, obesity. Obesity is recognized as one of the most significant risk factors for the development of uterine cancer, particularly endometrial cancer. So obesity is a big risk factor for uterine cancer because excess fat tissue can and will lead to higher levels of estrogen in the body. Women who are overweight or obese have a much significantly increased risk of developing uterine cancer compared to women of normal weight. Why? That's a great question. And the answer is because obesity is often associated with estrogen dominance due to the excess production of estrogen in adipose tissues. In obese individuals, the elevated estrogen levels contribute to this estrogen-driven growth of the endometrial lining, increasing the risk of uterine cancer development. So, excess body weight, especially abdominal or visceral adiposity, that spare tire around our midsection, is strongly associated with an increased risk of developing this type of cancer. And there are several key reasons why obesity is a major risk factor for uterine cancer. And I want to talk a little about each one of these reasons. Number one, estrogen production. Adipose tissue or fat cells can and will produce estrogen, which is a hormone that stimulates the growth of the endometrial lining, as I keep repeating. In obese individuals, specifically women in our case, the increased production of estrogen from the adipose tissue, from our fat cells, is not coming from our ovaries. So this can lead to a state of estrogen dominance where there's a clear imbalance between estrogen and progesterone levels. And this hormonal imbalance can and will promote the excessive growth of the endometrial cells. And again, unopposed excessive growth of the endometrial cell lining month after month and year after year will increase the risk of developing uterine cancer. Number two reason why obesity is a major risk factor for uterine cancer is insulin resistance. Obesity is often, if not always, associated with insulin resistance, a condition in which the body's cells become less responsive to insulin. Insulin resistance essentially means that the insulin receptor is malfunctioning, is not allowing your insulin produced by the body to do its work. The central control of the body detects a problem, and the only way it knows to fix this is to produce more insulin, which can and will lead to higher levels of insulin in the blood, which in turn will increase the production of insulin-like growth factor 1, IGF-1. And both insulin and IGF-1 have been implicated in cancer cell growth and proliferation, including the development of uterine cancer. Number three reason why obesity is associated with increased risk of uterine cancer is chronic inflammation. Obesity is characterized by chronic low-grade inflammation throughout the body. This inflammation can create an environment that promotes the growth of cancer cells and progression of tumors. Also, inflammation can contribute to insulin resistance and hormonal imbalances. They all go hand in hand. They're part of a bad player team, the opposite team, the one that we don't want to face. These are further risk factors for uterine cancer: inflammation, insulin resistance, hormonal imbalances. Number four reason why obesity increases risk of uterine cancer is alterations in adipokine levels. Our fat, also called adipose tissue, secretes various bioactive molecules. Those are called adipokines. Adiponectin and leptin are an example. Now, in obesity, there's often a dysregulation in the production and signaling of these adipokines, which can influence cell proliferation, inflammation, and metabolism in a negative way. Again, all of these factors together will drive the development of cancer, including uterine cancer. Number five is impact on immune function. Obesity can impair immune function, leading to a reduced ability of identification and elimination of cancerous cells. We know that the obese women have a weakened immune response, which may make it more difficult for their bodies to prevent the growth and spread of cancer cells in the uterus, specifically in our case, but for any other cancerous development in the body. And number six, because of its association with other risk factors. Obesity is often associated with risk factors for uterine cancer like PCOS, sedentary lifestyle, exposure to hormone disruptors, etc., which taken in combination with obesity will further increase the risk of developing uterine cancer. So addressing obesity or being overweight, maintaining a healthy weight is absolutely crucial for reducing the risk of uterine cancer and improving our overall health. If and when such weight loss is elusive and the woman remains obese or overweight in spite of lifestyle modifications or hormonal balance, that doesn't mean you have to give up. Then what we can do, we can have regular monitoring and screening for uterine cancer risk factors, which can help with early detection and prevention of this type of cancer. In my last episode, I highly recommended that women are annually screened for uterine cancer with an ultrasound during their annual wellness exam. I really talked plenty about this when I discussed how to diagnose uterine cancer, so please go back and listen. Now, I did take quite a bit of a detour and talked about how obesity increases risk of uterine cancer because it's a very important key factor, probably one of the most important ones. Remember, obesity means weakened immune system, inflammation, excess production of estrogen, a lot of bad things that it's almost like a shitstorm of trouble waiting to happen. So we talked about number 1, advanced age over 50. Number 2, hormonal factors, estrogen dominance. And number 3, obesity as the top 3 risk factors for uterine cancer. Number 4 is reproductive history. This is more important for women to know because they would need extra monitoring if they fit these situations. For example, early onset of menstruation or late menopause beyond 53, 54, or nulliparity, which means a woman has never given birth to children or never been pregnant, or a history of infertility. All these 4 circumstances may influence and increase the risk of uterine cancer in women. So if you do not have children, if you started having periods early or you had late menopause, both of these, then you have a much higher risk of uterine cancer. So please be aware, get checked frequently and often, and by a gynecologist, not your PCP. And I have a couple more. Number 5 is diabetes. Women with diabetes, particularly type 2 diabetes, will have an elevated risk of uterine cancer. I just discussed how insulin resistance and high levels of insulin have been linked to an increased risk of cancer, including uterine cancer. So we know that diabetes and cancer are related. And for example, a woman presenting to a gynecologist office complaining of postmenopausal bleeding that is obese with diabetes or insulin resistance is a typical presentation and is very suspicious for uterine cancer. Number 6 is genetics. Some women may have an increased risk of uterine cancer due to genetic factors. Now, that's pretty rare. But there are mutations in genes like Lynch syndrome, also known as hereditary non-polyposis colorectal cancer. There could be other hereditary cancer syndromes. Please be aware that women with Lynch syndrome have a 60% chance of developing uterine cancer. Most women have never heard of Lynch syndrome. Lynch syndrome can be tested. It's easy to test for it. It's a simple blood test. Be aware that if your family members, closer family members, parents, grandparents, uncles, cousins, have had multiple colon polyps or colon cancer, you could possibly be a Lynch syndrome genetic mutation carrier. Genetic testing can be done to determine the risk for these cancer syndromes. A person's blood or saliva sample can be tested to search for this genetic mutation that causes hereditary uterine cancer. Usually the test shows positive for a mutation, then the diagnosis of hereditary uterine cancer syndrome is confirmed. And next, that's useful because other family members may have a genetic test, might need it to learn whether or not they carry the same mutation and have the same uterine cancer syndrome risk. The test could be negative for a mutation. If no mutation is found, then the cancer in the family may not be hereditary. However, keep in mind a negative genetic test result does not eliminate the possibility of a hereditary uterine cancer syndrome in the family, and that is because current genetic testing technology is not able to identify all possible mutations that cause hereditary uterine cancer. It is possible that the uterine cancer in the family is caused by a gene not included in the test. So if somebody has uterine cancer and there's 2 family members, and you don't have the Lynch syndrome mutation, doesn't mean you don't have another type of mutation. And number 7, moving on, are lifestyle choices. Those are big risk factors for uterine cancer. Lifestyle choices like sedentary behavior, poor quality diet, excessive alcohol consumption, a very stressful lifestyle, these all contribute to increased risk of uterine cancer. And this is important when we talk about prevention, right? Number 8, and this is important, is avoiding regular screenings. I talked about this earlier in another podcast. Women are excellent procrastinators. Women are caregivers, so they take care of others first and themselves last. Please do not be one of these women. Be aware. Early detection of uterine cancer through regular gynecological exams, pelvic exams, awareness of symptoms can help diagnose it at a very early stage when treatment options are extremely effective and provide an absolute cure. If you have any unusual symptoms, especially abnormal vaginal bleeding, please report it to your healthcare provider, ideally your gynecologist, as soon as possible. I've talked about this very specific and very important sign, which is abnormal uterine bleeding. And I made a point in one of my previous podcast episodes about how any bleeding that occurs more than 1 year from a natural menopause is not a period. If you have not had a period for 12 months and you are over 50, any bleeding you experience past this point is considered and is called menopausal vaginal bleeding. It is no longer considered a normal period. You did not get your period back. You're not getting your period back. It is a sign of a possible problem, and you need to consider and take into account the worst case scenario. It is the sign of a possible problem, and you need to consider it and take into account the worst case scenario. The best case scenario is your healthcare improved and you suddenly made some estrogen on your own, which caused the bleeding. However, the worst case scenario is much more probable, and this might be the first sign of an abnormal process developing inside the uterus, a polyp, an endometrial hyperplasia, or a cancer. Also, women all feel slightly reassured when they bleed if they have fibroids because they were told fibroids bleed. Well, fibroids do not normally bleed after menopause. And if you know that you have a fibroid uterus, you have passed the 12 months mark from your last period, if your fibroids are bleeding, this is a sign of a possibly more serious pathology like a uterine sarcoma. So please do not ignore any annual wellness checkups as a woman. Ask your primary care provider to order a transvaginal ultrasound. Most gynecologists have a transvaginal ultrasound machine in their offices, and they can do it right then and there at the time of your annual. Or consider scheduling your wellness checkup with a gynecologist's office that can do your ultrasound at the same time as your annual. Also, screening for tumor markers like CA125 might be beneficial in these circumstances. So I talked a lot about risk factors. Well, obviously, in order to prevent uterine cancer, we will have to address the addressable risk factors. So I'd like to continue and end this episode by giving you 10 valuable tips on how to prevent and decrease your risk of uterine cancer. And each one of them is based on what we just discussed. Number 1, maintain a healthy weight. I went over this and explained how being overweight or obese can increase the risk of developing uterine cancer. Maintaining a healthy weight lowers your risk. Think a BMI under 28 as close to 25 as you can get. Number 2, eating a healthy diet. A diet rich in fruits, vegetables, whole grains, and lean proteins can help reduce the risk of uterine cancer. Avoid processed and sugary foods. That is crucial. I will come back and talk more about what type of diet will be best to decrease or avoid cancer in one of my future episodes, so please stay tuned. Number 3, exercise regularly. Regular physical activity will help lower the risk of uterine cancer. Aim for at least 30 minutes of moderate exercise on most days of the week. Exercise focused at increasing your muscle mass while decreasing fat composition will be highly beneficial. And many women after menopause are not aware that mild to moderate strength resistance, high-intense interval training, and weightlifting, maximum 3 times a week, can actually achieve a better body mass composition with an increase in muscle and a decrease in fat. Remember, a lean, muscular body is healthier than a body who has and carries the spare tire of belly fat, love handles, and back fat, really all of them around the midsection. Number 4, limit alcohol intake. Excessive alcohol consumption has been linked to many cancers, but specifically to an increased risk of uterine cancer. Limiting your intake to 1 drink per day or less can help lower this risk, can give your liver a break, and allow it, instead of processing alcohol, to actually process other byproducts of ingested foods, possible toxins and chemicals ingested alongside your food and your alcohol. Number 5, get regular pap smears. Regular pap smears can help detect abnormalities in your cervix that could indicate endometrial hyperplasia or uterine cancer. Occasionally, in a pap smear, we can detect the presence of endometrial cells in a woman over the age of 50. Now, it is not normal for these endometrial cells to be found on a pap smear. This usually prompts the need for an endometrial biopsy, which could be life-saving and detect an early cancer. Remember, it's important to schedule regular screenings with your healthcare provider, preferably your experienced gynecology doctor. And the annual pap smear every 3 to 5 years is driven by public health initiatives to cut costs, not by strategies to protect you. So consider a pap smear every year if your insurance covers it. If not, it's $65. It's not that expensive. Number 6, consider a well-balanced hormones. And consider, if you are going to use hormone replacement therapy, that it is well-balanced. Estrogen therapy, especially estrogen-only therapy, has been linked to an increased risk of uterine cancer. If you are considering hormone replacement therapy after menopause, please talk to your healthcare provider about the risks and benefits. Make sure you understand that estrogen that is not completely and adequately balanced by progesterone and possibly testosterone will lead to an increased risk of uterine cancer, possibly breast cancer too. Number 7 is discuss all birth control options with your doctor. We now have many birth control methods which can offer protection from uterine cancer. Some types of birth control, like birth control pills, have been shown to reduce the risk of uterine cancer. They do come with another price, but that's another topic for another day. So please talk to your healthcare provider about a best birth control option for you, especially if you're a woman at risk. If you're a young woman with estrogen dominance, obesity, and insulin resistance, you might need to consider a long-term intrauterine device with progestin, like the Mirena IUD. It has been shown to decrease the risk of uterine cancer because the progestin in the Mirena IUD has the effect of thinning out your uterine lining and completely opposing estrogen-driven growth of your uterine lining. Number 8, and this is a big one, and I actually want to make it the topic of a future podcast, probably the next podcast episode. Avoid exposure to estrogen receptor disruptors. We live in a toxic world. We are surrounded by many chemicals that are present in the air we breathe, in the clothes we wear, in the detergents we use to wash our clothes, in the perfumes and deodorants we use for freshening our scent, in the furniture we use in our homes, in the carpets and the laminate flooring we have in our homes. I could go on and on about this. So stay tuned. I won't talk too much about it now because it's the subject of my next episode. Number 9, know your family history. If you have a family history of uterine cancer or colon cancer, you may be at increased risk. So talk to your healthcare provider, your primary care doctor, your gynecologist about your family history and possible steps you can take to reduce your risk. If you carry a genetic mutation like Lynch syndrome, a hysterectomy could be very useful and could eliminate your risk of uterine cancer completely. And number 10, stay informed. Staying informed about the latest research and recommendations for preventing uterine cancer will help you make informed decisions about your health. So try to stay up to date on the latest information and talk to your healthcare provider about any concerns you might have, and please don't be afraid to ask questions. So I strongly believe that by following these top 10 strategies and staying proactive about your health, you can definitely help reduce your risk of uterine cancer. Remember, early detection is key, and 1 ounce of prevention is worth a pound of cure. So don't hesitate to talk to your doctor about any concerns or questions you may have. Your health is totally worth it. Thank you for listening. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.